Assalamualaikum and greetings to viewers out there. Comprehensive Health Information System with Integrated Mobility for Medicom Malaysia is a project developed by Dr. Nurul Hanim Othman and Syed Hussein bin Syed Abu Bakar. Medical Charity Organisation Malaysia, or simply Medicom, is a non-profit organisation focusing in health and medical charity. Medicom also actively organises mobile clinic which operates from place to another, usually in disaster location or rural area which has no access to public health service. Currently, they open 2 Wakaf clinic which provide free health service to the needy in Kampung Bahagia, Kuala Kerai, Kelantan and Kampung Pulau Mabul, Sempurna, Sabah. The clinics provide basic health and dental services and also minor surgeries such as male and female circumcision. Running a mobile or walk-off clinic manually, Medicom always face the ultimate problem, which is loss of patient history and pharmacy information. This is where when the patient lost his or her card, the clinic could not afford to store patient cards as the space are limited and not convenient. All records are stored in patient card and most cases, returning patient will not bring their cards. Stateless patient, usually in Pulau Mabul Wakaf Clinic, does not have a personal identification like IC or passport number. Some of them which have UNHCR card have identification but most of them do not. The problem is that how to store a patient information without identification in the database. If a mobile clinic organized in remote places with no access to the internet, EHR system will not be available to use. Currently, if a mobile clinic organized in remote places with no access to the internet, EHR system will not be available to use. Currently in the market, no EHR system that supports mobility or offline usage. This would be troublesome as Medicom regularly organize mobile clinic in remote areas in Sarawak, Sabah and disaster affected places like recently in Palu, Indonesia. Based on the problem that been identified before, the objective of the project are to provide comprehensive electronic health records system including patient records, volunteer records, medicine inventory and pharmacy for non-profit organisation Medicom Malaysia. To support mobility and offline function at no internet access in the rural area, to facilitate mobile support using smartphones for medical and dental photograph to manage patient records, and to ease operations and simplify clinic tasks and to maximize productivity. Electronic health record system is a kind of records management system rather expensive and sophisticated mainly because it employs high security to its data sensitivity. Hence, there are none available for this project as no mobility and offline support due to it involve area with no internet access, mostly in rural places. The system provides the offline mobility support through IoT devices, which is Raspberry Pi as its offline server. Integration between medical and dental. The system also integrates both medical and dental records and also able to store treatment consent within the app itself. For example, in the lab, it shows how a patient consent form can be signed directly in the system using mobile phone. The system also captures medical image directly to the database for any patient. This project gives high impact on society and humanity as it provides service to the community through technology. The system also can be used for data mining of people health in rural areas where mainstream health services cannot be accessed. For example, Medicom provides free health service such as medical, dental and circumcision to stateless citizens in Malaysia-Philippines border where the people does not have any citizenship on any country. These people did not have access to any public health service within both countries. The users, especially the medical practitioner, will benefit to this project by simplifying their routine tasks. This will greatly help them to give quality service to the people. Medicom will benefit from the system by managing their doctors, patients and nurses and easily can be accessed anywhere in the world. The records are also important if there are any complication or problem occurred in the operations. The patient will have less waiting time as the flows of the operation is improved. They also have their records and history intact for reference. By this, the patient will get better quality of health in the future as their health are monitored systematically by the system. The society will benefit this project as the usage of this system is for humanitarian charity. The importance of the project is there will improve their health status and give health awareness to the society. The system itself is a one of a kind which are ready to be implemented whether in private health sector or other non-governmental organization. The product itself can be sold to other organizations for commercial and Medicom can use it to generate income for their other projects. To date, Medicom has received several quotations requests from other medical NGOs for this system. For future recommendation, there are several recommendations and enhancements to improve the project. Facial recognition system, this feature will resolve the identification issues discussed before. Billing and accounting features, the capability to track purchases of medication, consumables, and instruments will give a value-added quality to the software. Expand to every field in medical. More medical fields feature can be added such as ophthalmology, obstetrics and gynecology and etc. The most beloved to Allah are the most beneficial to the people. Prophet Muhammad, peace and blessings be upon him. Thank you.